This is a really important topic right now for general internists because of two simultaneous epidemics that are going on. One is an epidemic of chronic pain that's really reached enormous proportions around our country, and then also an opioid epidemic, which is both prescription opioids and illicit opioids, with overdoses hitting record levels. Depending on the condition, consider physical therapy or NSAID therapy. Sometimes adjuvants such as gabapentin or certain antidepressants can have effective pain relief. Sometimes the best strategy for a patient is surgery, and it's not opioid therapy. So we need to think about these things and make sure that opioids are the best option for a patient, and that the patient fully understands the risks and benefits, and also understands what's expected of them if they're going to begin on opioid therapy. Okay, so some of the red flags that we might look for would be a patient who's really unwilling to participate in their care beyond just taking medications. Somebody says, I won't do physical therapy, or I'm not willing to try, cognitive behavioral therapy or other approaches, and really just wants a pill. That's very concerning. Certainly somebody who's had a history of uncontrolled mental health disorders, such as active depression or an uncontrolled anxiety disorder, that would be concerning. For a patient who you don't feel is a good candidate for opioid therapy on the basis of red flags, you certainly want to commit to that patient that you want to work with him or her to best manage their pain, and to use other strategies that you feel are safe and would be effective. And to just be frank with the patient that you feel that you can't responsibly prescribe opioids to that individual because you think you might be causing that person more harm than you would benefit them. Certainly some patients won't agree with your assessment that opioids aren't the best strategy, and sometimes patients will react with anger or with a feeling of being hurt or rejected or misunderstood. And sometimes it takes some time to really talk to that person, make a real clear commitment that you're interested in them as a person, you care about them as their physician, and that you really want to help them, but you just don't think opioids are the best approach. Sometimes patients will be willing to connect with you and to be willing to work with you, but sometimes they won't. And certainly I and many physicians have had patients walk out of the exam room angry. I think that that's a red flag as well. Somebody who's really unwilling to consider other strategies for pain management. That person may be just simply seeking the opioids and may be misusing them. That person may have an opioid use disorder as well.